Psychodynamic therapy is an approach that helps the client have a deeper knowledge of their emotions and other mental processes. It aims to give people more understanding of their feelings and thoughts. It is a form of conversation therapy. This indicates that its foundation is the idea that discussing problems might aid in people's learning and development of the abilities required to deal with them. Psychodynamic therapy aims to help the client identify important pieces of the puzzle that makes them who they are and rearrange them in ways that allow the client to form a more functional and positive sense of self. The primary focus of psychodynamic therapy is on unconscious processes as they appear in the client's current behavior. Psychodynamic therapy aims to increase the client's self-awareness and comprehension of how the past affects current behavior. In 1874, Freud proposed there were three levels to the human mind: the conscious that can be easily accessed, the preconscious that is just below awareness, and the unconscious. Freud believed that as people go through life, they sometimes have impulses and drives that do not match the moral direction of the superego. In some cases, people would unconsciously use defense mechanisms to alleviate any anxiety that those drives might cause. The defensive mechanisms include responses such as repression, regression, sublimation, projection, and many others. Freud believed that conflicts over unwanted feelings and unacceptable motivations often cause people psychological distress even if they were not directly aware. Unconscious motives affect our behavior and feelings powerfully. As adults, our feelings and behavior, including psychological problems, are rooted in our childhood experiences. Every behavior has a cause, usually unconscious. Therefore, all behavior is determined. Personality is made up of three parts, i.e., the ID, ego and superego. Eros, the sex drive and life instinct, and Thanatos, the aggressive drive and death instinct, are two instinctual drives. Our behavior is motivated by them. The conscious part of the mind, the ego, and the unconscious mind, the ID and superego, are in constant conflict. Personality is shaped as the drives are modified by different conflicts at different times in childhood, during psychosexual development. Present-day psychodynamics is most notably credited to Sigmund Freud, who has been known as the grandfather of psychoanalysis. Since Freud, many other theorists and therapists have contributed to psychodynamic theory and application in treatment. Some of these theorists include Carl Jung, Alfred Adler, Melanie Klein, Anna Freud, Otto Rank, along with many other pioneers. Conscious, preconscious, and unconscious. Beginning with Freudian theory, the human mind is essentially divided into the conscious, the preconscious, and the unconscious, sometimes referred to as the subconscious. One analogy of this separation of mental activity is an iceberg. The tip of the iceberg represents the conscious part of our minds, which contains everything we are immediately aware of, what we are concentrating on, planning for, and discussing within the private, internal dialogues with ourselves. When you look slightly below the tip of the iceberg, you see just enough below the water level, that's the preconscious. That represents something that is about to surface, just like when we have the name of someone on the tip of our tongues, and eventually becomes conscious. The much bigger piece of our minds is that larger part of the iceberg that goes far below our immediate awareness, the unconscious. Stage 1, Intellectual Awareness. The first few months, sometimes lasting up to a year, are spent obtaining an intellectual understanding the issues. The client learns all about himself, why you are anxious, depressed or angry, how you got that way, linking present habits with traumatic events during childhood, and what kind of situations in your present life are problematic. You become aware of what things trigger you, and what people you are vulnerable to. Stage 2, Emotional Awareness. The second stage involves the most difficult part of therapy. In this stage where the client must understand how they feel, and what they do with them. This is the part of therapy where they learn to really know themselves, something many wise people have written about. The hardest part about knowing yourself is recognizing your own faults. It is easy to look at the faults of others and how others are making you miserable, but looking objectively at yourself is perhaps the hardest thing any person can do. Stage 3, Reconstruction. Now the client have taken himself apart, then will need to rebuild themselves. Taking themselves apart involves individuation separating themselves from the self they were programmed to be from the upbringing. Perhaps themselves were programmed to feel afraid of opening up to people, and have deep-seated fears of doing so because in the family whenever they opened, they ended up feeling misunderstood and belittled. Reconstruction involves learning how to open and developing their own confidence in themselves. It has to do with building a new self from the ground up. Stage 4, Mastery. Toward the end of the third stage, the client reach a point where they feel more balanced and more grounded. They have gone through individuation and have developed a new personality that is more adept at taking care of themselves and their feelings. The new self has learned to handle people and situations that used to cause stress. The 4 phases of psychodynamic therapy. Evaluation. The initial assessment and history-taking phase. Introduction. Beginning the treatment, developing therapeutic relationship, setting goals, helping patient learn to use therapy. Mid-phase. Majority of treatment time is spent here. The therapist and patient work together to achieve the therapeutic goals set during the induction phase. Termination. Ending of the treatment, goals are consolidated, treatment is reviewed, the change that has occurred is appraised and role of future change is also evaluated, planning for future therapy, and termination of relationship. Psychodynamic therapy can help an individual battling addiction identify their underlying cause for using. By working through their emotions with a therapist, including unresolved conflicts, dysfunctional relationships, and much more, individuals can reduce their chances of feeling triggered to turn to drugs or alcohol again. Psychodynamic therapy allows individuals to address the deep-seated reasons why they use and provide ways to manage that impulse. Addressing these emotions head-on in therapy will lower the chances of relapsing in recovery. In addiction treatment settings, psychodynamic theory is applied to help guide the individual to examine past experiences that may have factored into the substance use disorder. By openly confronting these experiences, which may be painful, traumatic events from as far back as early childhood, the patient can process and eventually heal from the pain in a guided, therapeutic environment. Once this emotional healing has occurred, the underlying pain that may have fueled the substance abuse will subside, opening a clearer path to recovery. This type of psychotherapy seeks answers to an addict's current behaviors by delving into the past. The underlying principle of the psychodynamic model is that whether people are aware of it or not, the past influences the present. Past actions and the unconscious thought processes related to them can cause a recovering addict to perform harmful activities, which could, in turn, lead to a relapse of drug or alcohol use. By discovering the links between the past and the present, the therapist and client gain new insight into why certain behaviors occur at present. Experiences in the client's past, such as unresolved conflicts or problematic relationships, can manifest in the present without the person consciously realizing it. The therapy is helpful for people battling substance abuse because it identifies the underlying cause of addiction. During the sessions, the therapist works through the recovering addict's emotions to reduce the chances of succumbing to alcohol or drugs. Deep-seated reasons for using illicit substances are uncovered. The addict is taught ways to manage the impulses that trigger abuse. In terms of addiction therapy, the psychodynamic approach provides motivation to stop drug-seeking behaviors. It helps a recovering addict develop a better understanding of the unconscious thoughts that trigger harmful activities. It teaches coping mechanisms for a healthier drug or alcohol-free lifestyle. Several studies have shown that psychodynamic therapy is a valid and effective treatment for addiction with better outcomes than other therapies or no treatment. Islam counseling strategy is to order right and forbid wrong, amar ma'ruf nahi munkar. Helping clients who are struggling with psychological disorders is one of your duties as an Islamic counselor and is regarded as a form of treatment. By implementing the amar ma'ruf nahi munkar concept, we are helping the client build their inner power and capacity to keep them from harming their deen, nafs, aql and mal. This include listening to people, give them chance to express their inner emotions and thinking. Acts or deeds must meet a minimum of 2 fundamental requirements in order to be regarded as ibadah. First of all, it is carried out wholly sincerely, ikhlas, and alone for Allah's benefit. Naturally, it is done with a pure purpose, niyyah, which means for Allah alone in the strictest sense. The purity of honesty shouldn't be tampered with by other factors. The Islamic concept of man and understanding of human nature adopted by the clinician, and the resulting attitude toward the patient, are of paramount significance in therapy. Such conception of man acknowledges the patient's innate relationship to God, fitra, and the self-responsibility of humans for their actions. Adopting these views results in attitudes of empathy, respect, understanding, and acceptance of the patient by the therapist. Numerous scholars early on in Islamic history pondered the nature of human beings and their psychic life. A prominent example is Abu Hamid al-Ghazali, 1058 to 1111 AD. He conceived a model of human nature that still stimulates and guides psychological works of contemporary researchers and practitioners. His model describes the relationship between the ruh, aql, nafs, and qalb, whose interaction is essentially distorted in several disorders, and can be employed to evaluate therapeutic outcome on a long-term basis. In her childhood, Jen was physically abused by her father. Whenever Jen used to fail in any task that her father had asked her to do, her father used to get very mad and used to beat her. Jen used to get very saddened whenever it used to happen. She always tries to do things that make her father happy. Years later, when Jen got married and lives in her own house with her husband, she still shows the traits that developed in her due to the physical assault by her father. One day she had a very busy schedule at the work, and she forgets to bring home the cake that her husband had told him to bring. When she reached home, her husband asked her about the cake. She got terrified and reacted in the same petrified way that she used to react when she used to forget the tasks given by her father. Jen's husband got confused and was not able to interpret why she reacted in that way. This is based on the perspective of psychodynamic theory. The influence of the physical abuse that happened to Jen is still evident in her adulthood. Empirical evidence supports the efficacy of psychodynamic therapy. Effect sizes for psychodynamic therapy are as large as those reported for other therapies that have been actively promoted as empirically supported and evidence-based. In addition, patients who receive psychodynamic therapy maintain therapeutic gains and appear to continue to improve after treatment ends. Finally, psychodynamic therapies may be effective in part because the more skilled practitioners utilize techniques that have long been central to psychodynamic theory and practice.